This video is going to review the wrap you're going to receive on your treatment day. Now remember, treatment day is considered day 0. So if you're getting your wrap done today during your treatment, today is day 0, tomorrow is day 1, and then day 2, etc. Okay? Now the wrap we're going to show you is a standard wrap. There might be some variation on your particular wrap that you're receiving today, let's say during your procedure. So I want you to get your phone out and take pictures or a video of the wrap you're actually receiving on your treatment day. The wrap I'm going to show you today is standard. Okay, it's a standard first treatment wrap. So if you have it, this is your first treatment, this is the wrap you'll receive. If today's your second treatment or third treatment, it'll vary a little bit, and I'll point that out as I put the wrap on. Okay? Step is take your toe pads. Okay? Sometimes I talk in the first person or second person thinking you're doing this. So actually we'll be doing this on your treatment day, but if you have to do it, you'll be doing it just like this. Okay? Take your toe pad and it goes underneath the glands on the underside area. Okay? So we're going to put the toe pad on just underneath, press down, make sure it sticks well. Okay? And we put 2 of them. Now why are we putting 2 of them, or why are we putting toe pads for that matter? We want extra pressure in this area. Now I generally don't put filler here, but the filler I put all over here sometimes migrates into this area, and we want extra pressure on that area to prevent a bulging. So we got to watch this area. Okay? Now the next step is placing your large band-aids. Now when we place these on, there's 2 locations. Okay, one is the base of the penis on the top side. Half of it goes on the shaft, the other half goes on the pubic area. So try to visualize the pubic area being over here. Okay, so half on the pubic, half on the shaft to make sure this sticks well. The other large band-aid we're going to place on the underside. Okay, half again on the shaft and half on the scrotum. Okay, place that on, make sure it's sticking as best we place it on as best we can. Okay, and again, if you had to do this, you place it on as best you can. And there are those band-aids, large band-aids. Okay, these are very helpful. They're very protective of the skin because usually this area cuts in a little bit, so we got to watch that. Okay, now the next step is placing triamcinolone cream. So we'll put this on you, and how this goes is this: we put a little bit on the exposed skin that you could see, and then we kind of smooth it and spread it out, thin coat, right? All we need is a thin coat. We spread it on the glands, on the shaft, wherever there's visible skin, even on the scrotal area. Okay, and we spread that around. Next step is your brown stretch gauze. Again, all this is supplied in your blue bag when you leave. Okay, so you'll have all this. Take a very lengthy amount of this brown stretch. Okay, now if your penile erect length is about 6 or greater, you're going to overlap more with this. If it's less, then you don't have to overlap as much. Okay, so for example, if you're about 6 inches or longer in erection length, you'll overlap 90%. Not more tension, it's mild tension. And I'll show you this now. You start at the base, okay, and you work your way around with mild tension. Now I'm going to try and get a close-up of this in a moment. Let me just start. Okay. Now I'm going to show you what 90% looks like overlap. And then notice it's mild tension. 90% overlap forms a stiffer bandage, a thicker bandage. Prevents the penis from bending. So if your erect length is over 6 and the swelling occurs, which is normal, inflammation and swelling is normal, it might cause a bending of the penis temporarily, but when you overlap more, it makes it stiffer. Now, I'm going to try and show you this on the camera. Now that is about 90% overlap. Now I'm going to show you about 70% overlap. 70% is just a bit more, well, more spacing, I meant. 70% overlap is something like this. Very little difference. but that difference is important. Now, if you're not sure, just overlap more, so don't worry about it, okay? I'd rather you overlap more than less, okay? But it's especially important when you're longer to have more overlapping and a stiffer bandage, okay? So there is a little hard to tell, but there's 90% here and 70% there. And again, if it's uncertain, just overlap more. So I'm going to continue. Again, mild tension. There's only under certain circumstances we'll increase that tension, and we'll direct you on that, okay? But standard rule of thumb, mild tension. Now notice I'm going around. Notice over here I'm touching the glands. I don't want to go on the glands. But here I still have space to go. So what I'll do is I'll continue under the glands on this side and work my way up on this side to cover that toe pad, okay? So I'm all covered. And since I have a little left, I'll just work it around. And that's how it's going to look, okay? You see how that is. And I'll put a piece of white tape just to secure it. Even though it sticks on itself, I always like to have a little secure piece of tape there to secure it, okay? Next step. Some of this blue stretch, this is called pre-wrap. This comes in multiple colors. We just so happen to stock a lot of blue. Take a small strip of this, and you're going to put this on the base, okay? You'll notice that when you put the brown on, there's going to be a separation over here formed, okay? Because the penis extends as you put pressure on it from this brown gauze, and you'll notice a gap develop here, okay? It might not be so evident here because this is not living tissue, but if we put the brown on, and by the time you get to the top, you'll see a space develop here. That space is going to be covered with this. Just go around a few times, maybe 3 times or so, all right? And then you put a piece of tape to secure it. And you'll see that's how that looks. So you got that space covered now, right? So the entire shaft is covered. Now the next step, we want to connect this blue pre-wrap to this brown. So we're going to add some more brown starting directly on the blue and working our way up to about halfway. It's just a connector, okay? So let's take some brown. And we're going to start. I'm going to show you, you're going to leave a little blue edge there. If you see what I'm doing, the blue, leave that blue edge, work your way around. Okay. And you could see I left a blue edge all the way around, okay? And work your way up. Since this is a second layering, you don't have to overlap extensively, okay? But at least maybe 60–70%. And work your way up to where? What did I say? Halfway? Right about here. And then that's all we really need. We'll get rid of the excess. And we'll put some tape on to secure it. Remember, it could unfold on its own, even though you can see it's sticking on itself. Okay? So now we have, so far, a good amount of the wrap completed. Now, a couple of key steps coming. Next step is the half folds. Okay, there's 2 half folds. One is going to be down at the base with moderate tension. One is going to be up under the glands with mild tension. Now this is the first time I'm changing the tension. The tension down here is going to be moderate, okay, with the half fold, and then a rubber band is going to be on top of that. The reason is this is your barrier. And I'm going to discuss that in a moment. Let's just put the half fold under the glands, okay? Now the half fold under the glands, there's 2 types, okay? There's a swoop and a non-swoop method, okay? Let's go over the non-swoop. So for example, when you're having your treatment done, and we say we're going to use a non-swoop half fold, that means we're going to stay just under the glands, okay? Mild tension, and we're going to go around. See, I'm going around under the glands, and I'm going to go around about 2 times. And that's it. Okay, that would be a non-swoop. You see how that is? And of course I put a piece of tape to secure it, okay? Now if I do it, the reason why I left this extra here is because the non-swoop, you need a longer piece. The swoop rather. This is the non-swoop, okay? which is under the glands, and the swoop method, you need a longer piece, and I'll show you why. The swoop method starts differently. The swoop starts half on the glands rim and half on the shaft. So see where I'm putting this. Half on the glands, right? Half on the shaft. And what you're going to do is swoop down. You're going to go down first. And then you're going to swoop back up. Where? Onto that glands area where we started. And then you're going to swoop down, not as much. You notice we're covering a wide area here. And I'm going to come back around where? On the same location in the front. And then I'm going to swoop less. And notice what I did. I covered a wide area here and the same width over here. Right? So what are we doing? We're swooping down, covering a wide area here. We do that for certain reasons. But let me just show you, let me just finish this. You could just drop this here if there's any extra, and then we're going to put a piece of tape to secure it. The reason why we use either the swoop or non-swoop depends on how much foreskin you have under your glands, the remnant of the foreskin, and what is going to be best for shaping. And I'll make that decision on your treatment day. Now let's move on to the half fold at the penile base. This is part of your barrier. This prevents the filler from going out into the scrotum and to the pubic area. It's very important. So you're going to take this half fold, go down as low as you can. Now let's assume for a moment this is as low as I can go. You're going to still keep that blue edge there visible. If you can actually go lower, do so. Okay? Just go lower. All right? You're going to go like this, as low as possible, with moderate tension. Right? Go around 2 times, no more. And then after you go around 2 times, just tape. Just put a piece of tape. Okay? To hold it. Now take a close look at this, because it says this half fold is on with moderate tension, right? And it's as low as possible on the penile shaft. Now, next step and final step is your rubber band. Now we put 2 small rubber bands together and it forms a loop. 2 loops here. So what you do is you drop 1 loop down only. Okay, you drop 1 loop down all the way onto the half fold. The other loop is pointing toward the scrotum, and I'll tell you why in a moment. So let's get this set up. We want this loop, this rubber band, we say loop to rubber band, to sit at the very lower edge of the half fold. Okay, lower edge of the half fold. Okay, something like that, as you can see. Now why we have a loop here is every few hours you're going to take this looped rubber band off. It's easier to grab this and lift it off than trying to grab the rubber band directly. Okay. The second reason to have a loop is if you have to go to the bathroom. The urethra is right here, so the urine is going to flow right close to this area. And if you pull this, it releases the tension or pressure here. It'll help urination. So you pull it to help urination. Okay. Now sometimes this rubber band will roll down and it'll kind of go on to the skin over here. That we don't want. So if you have a difficult time keeping it in a low position, what you do is keep the front. This is the most important area to keep low. And on this side, what you can do is lift it a little higher and edge it into the wrap. Okay, this will help hold the rest of it up so it all won't fall down. Because this area in the front is the most important to keep it low. Okay, because we want, if it's going to form an indentation, because right, this is tension, right? If it's going to form an indentation into the penile shaft, it's going to be very low and not visible. But if this was higher, let's assume you did this instead. Let's say you kept this very high, right? Since you're coming out more on the shaft, it might leave an indentation in a visible location on the shaft. That's why this barrier has to be low, okay? In general, try and keep the whole thing low. That's a little trick. It's just in case it's sliding off, you edge it up in the back. But in this case, we're just going to leave the whole thing low, and that's how it should look. Let me just adjust that, and there you go. This is your wrap, okay? Now keep in mind, after we place this wrap on you, there's no need to change it until 72 hours passes. For example, if you have your treatment done on Monday, Tuesday is day 1, Wednesday day 2, Thursday, day 3. So toward the evening would be a full 72 hours on Thursday is when you would change the wrap, okay? And what you would do is on day 3, which we're going to have a separate video for your day 3 wrap, okay, is you're going to go in the shower, shower up, get this wet. Don't take it off yet, but just shower up first, get this kind of wet, and then take this off. It's easier to take this off when it's wet, okay? All right, so we're going to move on to your day 3 wrap, okay? And just review this video as often as you need to, okay? And then we're going to move on.